Immune therapy shows promise in treating depression. Researchers are exploring a groundbreaking approach to depression treatment, targeting the immune system. A recent study published in Molecular Psychiatry reveals striking similarities between the immune profiles of individuals with depression and those with inflammatory conditions like eczema. This discovery suggests that modulating immune responses, specifically within the type 2 pathway, could revolutionize how we address treatment-resistant depression. The connection between inflammation and depression for decades, evidence has hinted at a link between inflammation and mental health. Individuals with chronic inflammatory diseases, such as rheumatoid arthritis or eczema, exhibit higher rates of depression than expected. Stress, both psychological and environmental, activates the immune system, potentially contributing to depressive episodes. Even treatments for hepatitis C, once reliant on pro-inflammatory cytokines, were known to induce depression in a significant portion of patients. These observations led researchers to investigate whether common inflammatory markers in the blood correlate with depression. While the elevations are subtle, statistically significant increases in these markers consistently appear in individuals with depression. Breakthrough discovery. The Th2 pathway. The recent study from Mount Sinai took a novel approach by comparing immune profiles of depressed patients, eczema sufferers, and healthy controls. Researchers found that depression is associated with increased activity in the type 2 immune pathway, which normally defends against parasites, but becomes dysregulated in allergic and inflammatory conditions. To test this link, they used computer modeling to identify existing drugs that could suppress this activity. The standout candidate? Dupilumab, an antibody already approved for treating eczema. In animal models of depression, Dupilumab effectively resolved depressive-like symptoms. Human trials on the horizon. The research team, led by Dr. James Murrough and Dr. Emma Gutman-Yaski, is now preparing for a small clinical trial to evaluate Dupilumab in patients with treatment-resistant depression. If successful, this trial could represent a paradigm shift in psychiatric care, moving away from traditional antidepressants towards targeted immune modulation. We're right at the cusp of fundamental biology and neuroscience, knowledge starting to spill into how we actually practice the treatment of psychiatry. Dr. Murrough stated, "We're trying to move towards personalized treatments based on underlying biology. So instead of just saying a patient has depression, we can say, you have this type of depression, and therefore you need that treatment." Beyond inflammation. Rewarding the brain, the team also investigated the neurological implications of inflammation. Elevated inflammatory markers were linked to suppressed activity in the brain's reward system and heightened reactivity in the amygdala, the brain region responsible for processing threats. This suggests that immune modulation may not only correct underlying inflammation, but also restore normal brain function, improving motivation, pleasure response, and emotional regulation. The future of psychiatric treatment, while the concept of an immune subtype of depression is still evolving, the findings suggest that personalized medicine could soon be a reality in psychiatry. Blood tests identifying specific immune dysfunctions may enable doctors to prescribe targeted therapies, optimizing treatment outcomes and minimizing side effects. This approach promises a more scientific and effective way to tackle depression, offering hope for those who have not responded to conventional treatments. The study highlights a critical shift in understanding mental illness. It is not solely a neurological issue, but also a systemic one deeply intertwined with the body's immune response. This opens doors for new interventions that address the root causes of depression, potentially leading to lasting relief for millions.